Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show. So October, as we know, is Breast Cancer Awareness Month, one of my favorite months because so much is going on to bring, light to the disease. And we're going to be talking a lot about breast cancer this evening with Dr. Elena Rehl. She's with Tenet Florida Physician Services. She's a breast surgeon and on staff at Good Samaritan Medical Center. And she's got a lot of info for us. Really been looking forward to this show to learn about a little more because, breast cancer's been in the news, both for men and women. So without further ado, I'm going to welcome Dr. Rehl to the show. Dr. Rehl, how are you doing this evening?
Hi, David. Thanks for having me.
Thank you, and thanks for joining us. I always say on this adventure of health. So tell us a little bit about your medical specialty. So you're a breast surgeon. So you're the specialist who takes out the cancer out of the body, correct?
Yes, David. So I did my residency in general surgery, and then I did additional training. I did a fellowship in breast cancer surgery. And so I deal with all kinds of breast issues, anything from abnormal mammograms, breast infections, breast surveillance for patients that have high elevated breast cancer risk, and then I do breast cancer surgery.
Most importantly, to take the cancer actually out of the body. So we talked a little briefly in the past, so I didn't really think of this. Breast cancer obviously can strike women. It can strike men as well, and we're going to get into that as well. So let's talk a little bit about how breast cancer develops, if you could kind of give us a little light in that. So is it something that's genetic, or is it something that, as we read about, cancer, just, cells mutate, and for whatever reason, they may cause a cancer cell? How does it work? I mean, if you could just, explain in, general terms, because we're not a surgeon.
Sure, David. So when, the breast cells what's special about breast cells is that at the time of birth, the breast cells are immature and they really don't fully develop until after a woman has a pregnancy and breastfeeds. That's when the cells are fully mature. So over the course of life, these immature cells are very sensitive to hormones and to damage from things in the environment, and which can lead to, like you said, mutations that can lead to a cancer. And that is why breast cancer is the most common cancer in women.
That's a great point. The environment, because I don't think the general public really thinks about that as much. But you do hear that in other instances as well. Sometimes it can be a product of your environment, and then other connections as well. I'm just going to give out Dr. Rehl's info here. She's Dr. Elena Rehl. She's an MD and fellow of FACS, breast surgeon. She is on staff at Good Samaritan Medical Center in West Palm Beach, and she has an office right there, 1411 North Flagler Drive, Suite 5000, West Palm Beach. I'm pretty sure that's the Victor Ferris Medical Building. I've been there a couple times. Her number's 561-594-1850. But even easier, you can just type in her name. It's drelenarehl.com. Her website is DRELENA Rehl, REHL.com. Great website there. Ton of info. She's a board certified surgeon. Like she said, she did fellowship in breast surgery at Vanderbilt University Medical Center in Nashville, Tennessee. Did her residency at Tripler Army Medical Center in Honolulu, Hawaii. Her residency in general surgery there. Internship at Brooke Army Medical Center, San Antonio, Texas, in general surgery. And she went to medical school at the Uniformed Services University of the Health Sciences F. Edward Herbert School of Medicine in Bethesda, Maryland. So she is definitely very experienced and qualified, and we're so lucky to have her. Dr. Rehl, if you could just tell us a little bit about ways we can, keep away from breast cancer. I know, it's not a definite at all, but what are some of the things we can do, like diet, health-wise, exercise-wise, even, alcohol consumption, and I think you even noted hormone replacements as well.
Yes. So, David, there are risk factors we can control and some we can't control, but the ones we can are keeping our immune system very strong. And the best way to keep our immune system strong so that we're able to fight off any cells before they become a cancer is working up a sweat several days a week with exercise and eating healthy, avoiding processed foods, eating green vegetables, and managing stress. None of us can avoid stress in our life, but we have to find ways to manage it, and that can be different for each and every person, depending on what works for you.
Most definitely, yeah. Definitely stressors. I'll tell you, as I'm getting older, definitely watching the stress levels. Never really looked at it before, but men and women definitely got to watch their stress. And, great points there as well. Diet, everything in moderation as well. So, Dr. Rehl, I didn't mention before, but obviously from just reading your bio there, you're a veteran of the U.S. Armed Forces. So, again, thank you for your service. That is awesome to have you on the air.
Thank you, David.
And I just want to talk a little bit about you're also a native of Jupiter, Florida. We connected there. I'm a native of Jupiter, Florida as well. I know you're really excited to return back to the area, and you had some experience in practice in Savannah, Georgia. So we're really happy to have you back in West Palm Beach. How has it been since you back home? I know you kind of hit the ground running. You've been pretty busy in the West Palm Beach area.
Yes, it's been great. I have been busy, and that's exciting because I came from a very busy practice, and I'm excited to take care of anyone with breast cancer in this community because that's what I've been doing for the last 7 years. So
that's great, and we're so happy to have you. We're going to talk with Dr. Rehl about a couple different things this evening. If you have any questions, the number's 1-888-565-1470. We're going to talk a little bit about the signs and symptoms as well. We talked a little bit about, what to avoid and breast cancer in general. So what are some of the normal signs and symptoms that, people who seek medical attention? Obviously, with you, you're a surgeon, they probably go to their primary care and refer to you, but what are some of the signs and symptoms that they're probably seeing and that alarms them and it's time to make an appointment with a doctor?
Well, David, to be honest, most people they don't have any symptoms. It's just something that shows up on their mammogram, which is good because that means we've found it early. Some people may notice a lump, or they may notice nipple discharge or changes in their skin.
Okay, so now is it still the general idea to do breast exams after a shower? Or is there a certain time a woman should do a breast exam?
The main thing is you just really want to be aware of your breast. You don't have to do an exam per se, just like you would be aware of any other part of your body, know what's normal for you, and if something changes, get it checked.
All right, great. We're going to take a quick break and right back. We'll have Dr. Rehl on the You and Your Doctor show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back on the You and Your Doctor show, Living a Longer and Healthier Life. We're here with Dr. Elena Rehl. She's a breast surgeon with Tenet Florida Physician Services and Good Samaritan Medical Center in West Palm Beach. Dr. Rehl, welcome to the studio.
Thank you for having me, David.
And thank you for joining us on this adventure of health. I want to get into a couple of your areas of interest, listed on your website, because I always say general public, but, because we don't have the knowledge that you have as a surgeon, but we like to, listen and learn a little bit. But a couple of them I wanted to put you on the spot here a little bit. You kind of mentioned a couple of them. High-risk surveillance. What exactly is that, and why is that an area of interest?
So, David, really every woman is at risk for breast cancer. If you have breast and you're a woman and you're getting older, you're at risk for breast cancer. But there are certain groups of women and or men, because men can get breast cancer too, that fall into a high-risk category. And those are people with either identified mutations that would predispose them or certain other risk factors that we have identified those patients at high risk, and then we can make a plan for high risk surveillance. And there's a spectrum of how we manage patients that are high risk, starting with just increased surveillance, adding on an MRI to their annual mammogram. There's medications we can use to lower their risk, and then there's surgery we can do to lower risk.
Wow, that is really in-depth. So does genetics fall into the high-risk surveillance as well?
Yes. So certain families have genetic mutations that are passed down, which they're actually really rare, but they do exist. And that can put someone at a higher risk, and, a risk 50% or higher. And then those patients, we really keep a close eye on them.
And I'm sure you hear a lot about this. I'm sure people ask you all the time about the BRCA gene and Angelina Jolie. The first thing I knew when you were coming on the program is look up that story because I wanted to learn a little bit more. But that's one of those genetic components.
Yes.
is the BRCA gene, right?
Yes.
Am I saying that right, BRCA?
Yes.
Okay,
so
good.
BRCA, it stands for breast cancer gene. That's one of the first identified mutations that we know of that predisposes families, and it's those families with those mutations you'll see early onset cancers before the age of 50, breast cancer and ovarian cancers.
Oh, wow. Okay,
yes.
so they go hand in hand. Wow, that's
Yes.
tough. So it's definitely good to, have that high-risk surveillance
Yes.
is what we're getting the word out on. So let's also talk, how often should a woman have a mammogram? Is it a yearly thing and starting at a certain age? Is it?
Yes.
Okay.
So you want to start, if you're average risk, you want to start at age 40 every year with your mammogram. And there's some controversy about that where, the controversy is that screening does get expensive, especially if there are biopsies that are negative. But the reality is that the sooner, if there's a cancer there, the sooner we find it, the easier it is to treat. We may be able to remove it with surgery, and if we wait longer, find the cancer later after it's spread to the lymph nodes, that's when patients will need chemotherapy. So that's the whole point of screening every year, starting at age 40. And if, you have a first-degree relative that's been diagnosed with a breast cancer age 40 or younger, then you would start 10 years prior to the age they were diagnosed with breast cancer. So if your mom was diagnosed with breast cancer at age 45, then you would start screening at age 35.
I'm going to give out Dr. Rehl's info, and then on the other side, I'm going to ask her about if all breast cancers are cancerous, because I didn't know much about it. There's two sides of it there, and if they're not, do they need to be removed? But let me give out her info again. I'll give it out a couple more times. It's Dr. Elena Rehl. You can find her at DRELENAREHL.com. Right there's a ton of info. Practicing medicine since 2000, on staff, like I said, at Good Samaritan Medical Center in West Palm Beach, and right in the Victor Ferris building right next door, right? Okay, I was right about that, on the medical campus of Good Samaritan Medical Center, 1411 North Flagler Drive, Suite 5000 in West Palm Beach. The number's 594-1850. Again, it's 561-594-1850. So, Dr. Rehl, so there's also breast cancers that aren't cancerous that, grow and then they need surveillance as well, or not?
So I think maybe what you're referring to is proliferative lesions.
Okay, that's what I meant, because it wouldn't be breast cancer if, okay.
So sometimes there's changes in the breast, cellular changes that would increase someone's risk for breast cancer, and those are usually found when there's an abnormal mammogram, a biopsy. It's not a cancer, but it could be an atypical cell, and then those patients we may follow.
Okay, and so what I was getting to before I messed that up there was, do those lesions have to be taken out?
Some do. It all depends.
Okay, so
it
it's
depends
a case by
what
case.
it is. Yes.
Every case is different, I imagine.
Yes.
Okay, so let me also ask you this, because it's been in the news. So Beyonce's father, Matthew Knowles, and I saw this a few weeks ago, came out and said that he is being treated for breast cancer, and it was kind of a shock to a lot of men. I had forgotten. I had remembered a few years back when I was a chef, I knew a restaurant owner who actually had breast cancer and kind of the same kind of symptoms as I read Matthew Knowles' story. So is it very rare for men to get breast cancer?
It is rare, but it does happen, and that's why, it's important for men to realize if they have a lump in their breast to get it checked, because just like if you have a lump anywhere in your body, get it checked, but if it's in the breast, it can be a breast cancer. And men diagnosed with breast cancer, it's important for them also to have genetic testing, because when families carry a genetic mutation, they have a higher incidence of men in the family with breast cancer. And they can't, if a man does have a genetic mutation that predisposes to breast cancer, they can pass that gene on down to their son or daughter.
Oh, wow. I didn't know that. Yeah, and I was reading his story. It's some of the same symptoms, the discharge. He said he kept on noticing the littlest red dot on the shirt he was wearing is when he first started noticing something. And good for him, because he took it to the next level, and it became obviously preventative medicine. They're treating it, and, hopefully it doesn't, spread it. And I haven't heard anything yet. But he's also using, his fame to bring awareness to it as well, to men's and women's breast cancer. So that kind of hit home to me and all the men out there. I've talked about it with a couple of my peers as well. So we're here with Dr. Elena Rehl. I'm going to get it right before the end. It's Dr. Elena Rehl. She's with Good Samaritan Medical Center and Tenant Florida Physician Services in West Palm Beach. Again, it's DRELENAREHL.com or 561-594-1850. A ton of info on the website if you want to learn a little bit more about her as well. Board certified surgeon. Now, you have had an interesting road to becoming a surgeon. You actually were in the military and did your medical school internship, residency, and fellowship. Tell us a little bit about that experience, and if you don't mind, where you served.
Yes, so I went to the military medical school in Bethesda, Maryland. Then I did my internship and residency in the military. And when I finished my surgery residency, then my first duty station was Germany. And from there, I deployed to Iraq for a year. And then I moved around quite a bit and went back to Iraq a few years later. When I got out of the Army, I went back and did a fellowship in breast cancer surgery at Vanderbilt.
At Vanderbilt, yeah, that's great. So when you were in Iraq, you're part of the surgical team then?
Yes, I was part of a forward surgical team, which is basically like a mobile operating room. We had all of our equipment in 3 tents, and we could carry the equipment and set it up wherever we needed to. Unreal.
That's really neat. Thank you for your service, definitely.
Thank you, David.
Yeah, thank you. And it's so neat to have you on the program. I know you're also won the Bronze Star Award. You're a Bronze Star Award recipient as well, correct? Thank you. So that is great to have you on the program. Now, let me ask you a little bit also about guidelines for self-exams. We talked about, when women should do it, but is there a specific guideline as well?
So there's really not a specific guideline for breast self-exams. The key thing is, that we should teach our daughters, starting at a young age, to be aware of their body and to know what's normal for them, and if something changes, to get it checked.
Yeah, get it checked earlier than later.
Yes.
Because like you said, the longer you wait, it can go, I think you said, to the lymph nodes and other areas as well. How much, since you started in the field, how much has it changed? I mean, take us through a little bit through surgery, surveillance, et cetera. Because when I have doctors on this program, I mean, the technology, the way it's moving is just, it's tremendous for the patient. I mean, we were talking to heart surgeons who used to do open heart surgeries, and now they're doing minimally invasive surgeries through like less than probably an inch under the ribs. I think one of them said these open heart procedures that they used to have to do. So how has it changed technology wise in just the what do you say 7 years that you've been in the field?
So
that you've been practicing?
generally speaking, so much with breast cancer has changed since really the 70s. And, we've kind of evolved from a one-size-fits-all treatment of breast cancer, which was, back in the late 60s, early 70s, women with any breast lump had what we call a radical mastectomy, and that was removal of not only the breast, all the lymph nodes, and the underlying musculature, which really left a huge deformity. And since then, we progressed to just removal of the breast, and then even not just mastectomy, but lumpectomy and radiation. And even with the lymph node surgery has progressed from, we used to always remove all the lymph nodes. Now we usually just remove one. But interestingly, things are evolving back to more surgery where with reconstructive techniques, there's a trend back towards mastectomy with nipple sparing. So surgically, things have trended back and forth.
That's great.
A lot did change with breast cancer, which is why I went back and did a fellowship, because after...
I gotta stop you there. We're almost out of time. So I just want to thank you again for coming on the program. And next time we'll get a little more into it. It's drelenarehl.com. Thank you again.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.